going to be discussing different job opportunities as far as the Army goes and nursing and psychology. The objectives within this presentation are going to be officers within the Army, nursing corps specifically, psychology in the Army, civilian nursing, nursing school, and further information. Within the Army, there are two different types of officers. There are non-commissioned officers who typically enlist after high school into the Army, and commissioned officers are college graduates who go through a program like Officer Candidate School or ROTC. Neither one is better, they just take separate routes. Within the Army, there are several different branches. My focus is nursing because I'd like to obtain my Bachelor's of Science in Nursing. To become a nurse within the Army, you must either take the ROTC route or the Officer Candidate School route. The ROTC route is 4 years long. You must obtain your bachelor's degree and go through physical training, military science classes, and other types of soldiering techniques. Upon graduation, you'll commission as a second lieutenant and typically of 4 to 8 years, depending on your branch of choice. If you decide that the ROTC route is not for you, there's also an Officer Candidate School route. It can take 1 to 2 years, depending on your branch of choice. For those who want to join the Army on the medical side of things, but do not have a nursing degree, there's also a Medical Services Corps, which is extremely similar to the nursing corps. There are also active duty and reserve routes. Active duty is a full commitment, and reserve is only part-time. Psychology in the Army is very interesting. There's actually no corps in the Army specifically for psychology. However, within the realm is clinical psychologist. As a clinical psychologist in the U.S. Army, you'll have the opportunity to work with your ward and patient-based soldiers and their families in a variety of settings and conduct vital life-saving research alongside committed and focused colleagues. There's different job duties as a clinical psychologist within the Army. Typically, you'll work with trying to expand education. You'll also work with veterans who are dealing with PTSD or other types of problems they may have encountered over their time serving the country. Not only will you work with veterans, but you'll work with first-hand soldiers who have come back from deployments or who are currently deployed. Not only do clinical psychologists help soldiers, but they also help aid dependents or family members of those serving in the Army. The requirements for a clinical psychologist are a doctoral degree, counseling psychology, or other subspecialties. You must have a current unrestricted license for practice and be between the years of 21 and 42. You must also have your citizenship. Furthermore, I'm going to talk about different types of nurses. Working our way up from the bottom to the top are certified nursing assistants, which I actually am. I went through a 5 to 6 week program as well as clinicals, and I obtained my certificate. There's also licensed practical nurses, which takes a bit longer, and they typically work on paperwork as opposed to hands-on type of things with the residents, like certified nursing assistants do. Registered nurses, Bachelor's of Science in Nursing, nurse practitioners, and physician assistants are also types of nurses. The focus on this slide and this presentation will be RNs, BSNs, NPs, and PAs, specifically because they require a degree. We've already discussed nursing corps within the Army. However, there's many other women who would prefer to work as a nurse and psychologist within the civilian world. You can do this within hospitals, family practice clinics, and other types of healthcare facilities. Upon completion of either just your nursing prerequisites or both your nursing prerequisites and bachelor's degree of any choice, the next step is for someone to apply to a nursing program. There are different programs upon applying for nursing. For graduate level nursing, RN, CSN, NPs, and PAs, there's extra schooling in which you must apply. If you have a bachelor's degree in conjunction with your nursing prerequisites, you can can apply to a standard nursing program or an accelerated program. They offer accelerated programs typically because people with a degree and a nursing prerequisite are looking to get through the nursing program faster than those who just have their prerequisites finished. You may also choose to go to school to become either an RN or BSN. A BSN is typically a year longer of schooling, and the difference between BSN and RSN is obviously their greatest pay, and BSNs have the opportunity to actually teach nursing classes. The last route requires more schooling to become an NP because with these degrees we are able to prescribe medication and diagnose illnesses. Further expand your knowledge, here are some websites with more information. Thank you for listening to my presentation.